In this lecture, we'll be discussing about senile cataract. Now, a small note on the structure of the lens. It consists of an anterior capsule, a posterior capsule, the cortex, and the nucleus. Now, the lens fibers are arranged as cortical fibers and nuclear fibers. The cortical fibers are the newly formed younger fibers, and the nuclear fibers are relatively older. And they are further divided into the embryonic nucleus, the fetal nucleus, the infantile nucleus, and the adult nucleus. Now, the definition of cataract. Now, the term cataract, it refers to the development of any opacity in the lens or its capsule. So this is the development of cataract. Now, how can an opacity develop in the lens or the capsule? Now, cataract can occur due to, number one, formation of opaque lens fibers, and this is the basis of congenital cataract. Or cataract can occur due to degenerative process leading to the opacification of the normally formed transparent lens, and this is what is known as acquired cataract. Now, in this lecture, we'll be discussing in detail about senile cataract. Senile meaning age-related cataract. Now, senile cataract, it is the most common type of cataract affecting people above the age of 50 years. Okay, when it occurs before the age of 45 years, it is known as pre-senile cataract. But clinically, if the patient is above 50 years and presents with cataract, that is, if the patient is around 60 to 70 years with cataract, we term it as senile cataract. And if the patient is below 50 years, it is termed as pre-senile cataract. Now, a one mark question that can be asked is Christmas tree cataract, it is seen in which condition? And Christmas tree cataract, it is typically seen in myotonic dystrophy. Okay, so this is the Christmas tree cataract. Now, moving on to the morphological types of senile cataract. Now, senile cataract, it can be divided into cortical senile cataract, nuclear senile cataract, and mixed cataract. Now, cortical cataract means that the opacity is present in the cortex of the lens. Nuclear cataract means the opacity is present in the nucleus of the lens, and if it's mixed, there is opacity in both the cortex and the nucleus. Now, the cortical senile cataract, it is again divided into the cuneiform cataract and the cupuliform or posterior subcapsular cataract. So this is the morphological types. So senile cataract, we have cortical and nuclear and mixed. Cortical is again divided into cuneiform and cupuliform or posterior subcapsular cataract. Now, some risk factors for development of cataract is age greater than 50 years, heredity, UV radiation exposure, diet deficient in certain vitamins and proteins, and smoking. Now, coming to the etiopathogenesis of cataract, or why an opacity develops in, or how the opacity develops in the lens. Now, the pathology is different for both cortical senile cataract and nuclear senile cataract. In cortical senile cataract, basically there is hydration of the lens, which leads to coagulation of the proteins, and this leads to the opacification of the cortex. So again, in cortical senile cataract, there is decreased levels of protein and potassium in the lens, and an increased level of sodium along with hydration of the lens. All of this will lead to coagulation of the lens proteins, leading to opacification of the cortex. So the term you need to remember in cortical senile cataract is hydration of the lens, leading to coagulation of the lens proteins. In nuclear senile cataract, there is age-related sclerosis of the nucleus of the lens. Sclerosis meaning hardening or stiffening of the connective tissue. So in nuclear senile cataract, there is age-related sclerosis of the nucleus of the lens. So this is nuclear senile cataract. So pathology in cortical senile cataract is hydration of the lens, and in nuclear senile cataract, it is age-related sclerosis of the nucleus of the lens. Now, the stages of maturation of cataract. Now, it is different again in cortical cataract and nuclear cataract. And the stages of maturation of cortical senile cataract is often asked as a short essay or a short note. So let us discuss this in detail. Now, the stages of maturation of cortical senile cataract involve the stage of lamellar separation, the stage of incipient cataract, the immature senile cataract, the mature senile cataract, and the hypermature senile cataract, which is again divided into the Morgagnian type and the sclerotic type. Now, the terms incipient cataract and immature cataract are often interchangeably used, but because it is given in the text, we'll be discussing in these as different. So we have again stage of lamellar separation, incipient cataract, immature, mature, and hypermature senile cataracts. Now, beginning with the stage of lamellar separation. Now, we've already mentioned that cortical cataract occurs due to hydration of the lens. So in this first stage, there is formation of vacuoles and water clefts in the anterior and posterior cortex, leading to the demarcation of the cortical fibers. So again, there is formation of vacuoles and water clefts, and this leads to the demarcation of the cortical fibers. So this is the first stage, the stage of lamellar separation. Next, we have the stage of incipient cataract, and in this stage the opacity develops further, and let us see how the opacity develops in cuneiform senile cortical cataract and cupuliform. So remember, cortical cataract is of two types, cuneiform cataract and cupuliform, and the development of opacity is different in both. Now in cuneiform senile cortical cataract, wedge shaped opacities with clear areas in between develop, and these extend from the equator towards the center, as you can see in this diagram here. So this is the wedge shaped opacities with clear spaces in between, okay, and they develop from the equator towards the center, and such a pattern is known as radial spoke like pattern of grayish white opacities. So this is the cuneiform senile cortical cataract. Again, wedge shaped opacities extending from the equator towards the center. Now this can only be demonstrated after dilation of the pupil. Why? Because it develops from the equators towards the center of the lens. Next is the cupuliform senile cataract. Now in this cataract, there is saucer shaped opacities which develop just below the posterior capsule, and it extends outwards. So you can see in this diagram, this is the anterior capsule, this is the posterior capsule, this is the saucer shaped opacity just below the posterior capsule, and hence cupuliform cataract is also known as posterior subcapsular cataract. Okay, so this is the cupuliform senile cataract. So remember, in the stage of incipient cataract, we have cuneiform cataract, in which there is formation of wedge shaped opacities with clear areas in between, and these extend from the equator to the center. But in cupuliform cataract, there is saucer shaped opacity which develop just below the posterior capsule, and these extend outwards, that is from center to equator. Okay, the next stage is the stage of immature cataract. Now here the lens appears grayish white, but there is still presence of clear cortex, that is, the opacification isn't complete, and because of this, iris shadow is visible. Then the lens in this stage may be swollen due to hydration, and such a lens is known as intumescent lens, and such a cataractous lens is known as intumescent cataract. Okay, so again, immature senile cataract, the lens appears grayish white, but the cortex is still clear and the iris shadow is visible. And the lens, if it is swollen due to hydration, it is known as intumescent lens and intumescent cataract. The next is the stage of mature senile cortical cataract. Now in mature senile cortical cataract, the opacification is complete, that is, the entire lens becomes opaque, that is, the entire cortex of the lens. Okay, when I'm discussing mature senile cortical cataract, and hence the entire cortex of the lens becomes opaque, and such a lens is pearly white in color, as you can see in this diagram here. So this is the mature senile cataract. So we've discussed lamellar separation, incipient cataract, immature cataract, here it is grayish white lens, and finally mature senile cortical cataract. Now if a mature senile cortical cataract is not treated, it develops further into hypermature senile cortical cataract. Now when the mature cataract is left in situ, the stage of hypermaturity sets in, and now this is of two types. We have the Morgagnian hypermature cataract and the sclerotic type hypermature cataract. Now in the Morgagnian type, what happens is, after maturity, the whole cortex liquefies and the lens is converted into a bag of milky fluid. Okay, and the small brownish nucleus, it settles at the bottom. So in this we have a milky white cortex, and a small brownish nucleus which is present at the bottom. This is the Morgagnian type. So you can remember this by Morgagnian M for milky white, hence the cortex liquefies and becomes a bag of milky fluid, and the nucleus settles at the bottom as a small brownish entity. The next is a sclerotic type of hypermature cataract. Now, in the Morgagnian, we said that the cortex liquefies. In sclerotic type, after maturity, the cortex disintegrates and the lens becomes shrunken. And because the anterior cell becomes wrinkled and thickened due to proliferation of the epithelial cells, a dense white capsular cataract is present. That is, first the cortex disintegrates and the lens shrinks, then the anterior capsule proliferates and thickens, and this gives the dense white capsular cataract. So again, the stages of hypermaturity, we have Morgagnian type, in which there is a milky white cortex with brown nucleus at the bottom, and in sclerotic type, the anterior capsule thickens and forms a dense white capsular cataract. So this is the stages of maturation of cortical cataract. So again, remember, lamella separation, incipient cataract, immature, mature, hypermature cataract. Hypermature cataract is again divided into the Morgagnian type and the sclerotic type. Now, the maturation of nuclear cataract isn't important, but I've mentioned it for namesake. Now here, the nuclear sclerosis, that is the hardening and stiffening of the nuclear fibers, it continues until the lens is hard and inelastic. Now, due to deposition of pigments, the lens may become diffusely cloudy or tinted, and it may acquire red, brown, or black color. Red, brown, or black colors. So this is the maturation of nuclear cataract. Basically, the sclerosis continues until the lens is hard and inelastic. Now, coming to the clinical features of cataract. Now, basically, we have a lens with an opacity. Therefore, the proper refraction of light does not occur, and because of this, the symptoms are seen. Now, the symptoms are glare, euniocular diplopia and polyopia, colored halos around light, blurred images, and deterioration of vision. Now, the deterioration of vision is can be of two types. Now, in patients with peripheral opacities, that is, example is cuneiform cataract, the vision is better when the pupil is constricted. Now, why? If we come back to this diagram here, if the pupil is constricted, the opacities disappear, right? And hence such patients, their vision is better in bright light. And in patients with central opacities, that is the opacity is in the center, and hence if the pupil is dilated, more light can pass, and hence vision will be better. The patient will say the vision is better in dim light, and hence during the day the patient has blindness, and this is known as day blindness. So this is the deterioration, the difference in deterioration of vision in patients with peripheral opacities and central opacities. So these are the symptoms. Now, coming to the signs. Now, the important signs of cataract are the changes in the visual acuity, the color of the lens, presence or absence of the iris shadow, and whether the fundus can be seen or not. Now, usually the differences between immature and mature senile cataract are usually asked. Now, in immature cataract, remember, the opacification isn't complete. Therefore, the patient is still has vision, but it is defective, and the visual acuity ranges from 6-9 to counting fingers. Whereas in mature cataract, the lens is completely opacified, and hence the patient will not be able to see compared to that of a patient with immature cataract, and such patients will only have visual perception of hand movements or perception of light. So this is the difference between the visual acuity. The next is the color of the lens. Now, in immature senile cataract, the color of the lens is grayish white, whereas in mature cataract it is pearly white. Next is the iris shadow. Now, the iris shadow, it is present in immature senile cortical cataract, whereas it is absent in mature senile cortical cataract. Now, a shadow can only be found when the light is able to pass through the lens, and because some clear fibers are present in the immature cortical cataract, the iris shadow is visible, whereas in mature senile cataract the entire lens is opaque, and hence iris shadow is not seen. Then the fourth is whether the fundus is visible or not. Okay, now fundus is basically the back of the eye. Now, if the entire lens is opaque, then the fundus is not visible, and hence in mature senile cortical cataract the fundus is not visible, whereas in immature senile cataract the fundus is visible. So these are the signs of signs to distinguish immature and mature senile cortical cataracts. We have visual acuity, color of lens, iris shadow, and whether the fundus is visible or not. Now coming to the complications. Now three complications are present. Complications of cataract. So first is subluxation or dislocation of the lens, which results in lens-induced glaucoma, and the third is phacoanaphylatic uveitis. Now the first is subluxation or dislocation of lens. Now this can lead to lens-induced glaucoma. Okay. Now glaucoma will be discussed in detail in another lecture, but for now a basic idea. The normal flow of aqueous humor, which is produced from the ciliary body, is through the posterior chamber into the anterior chamber and out through the trabecular meshwork, which is present at the iridocorneal junction. Now in open angle glaucoma, this angle is open, okay, and hence the buildup of aqueous humor occurs due to the blockage of the trabecular meshwork, and hence aqueous humor builds up and increase in ocular pressure, leading to glaucoma. Now in closed angle glaucoma, the iridocorneal angle is closed, and this can occur due to the dislocation of the lens. So this is the difference between the open angle and closed angle glaucomas. Now lens-induced glaucoma is again of three types. We have phacomorphic, phacolytic, and phacotopic glaucoma. Now phacomorphic glaucoma. Now the swollen and cataractous lens. Okay, the swollen and cataractous lens, it can cause secondary angle closure glaucoma. So this is the normal lens, it's swollen, and this leads to the secondary angle closure glaucoma. The next is phacolytic glaucoma, and this is seen in Morgagnian type of hypermature cataract. And here the lens proteins, it leaks into the anterior chamber, and this is engulfed by the macrophages. Now the swollen macrophages, they come and block the trabecular meshwork, and hence there is secondary open angle glaucoma. The next is a phacotopic glaucoma. Now in the hypermature cataractous lens, it may dislocate or subluxate, causing the closure of the iridocorneal junction, leading to secondary angle closure glaucoma. So lens induced glaucoma, we have first is a phacomorphic glaucoma, which is due to the swollen lens. Next we have the phacolytic glaucoma seen in Morgagnian type, where the lens proteins leak into the anterior chamber. And finally we have the phacotopic, that is the lens dislocates or subluxates. And the final complication is phacoanaphylatic uveitis. Now here the lens proteins which leak into the anterior chamber, it induces antigen antibody reactions and causes inflammation of the iris and ciliary body, and this is known as phacoanaphylatic uveitis. Uveitis meaning iris and ciliary body. So again, the complications: subluxation or dislocation of the lens leading to lens induced glaucoma, and the third is phacoanaphylatic uveitis. Now the treatment of cataract, now this itself is an short essay or a short note, so this will be discussed in detail in another lecture. For now, just remember, there is removal of the cataractous lens and implantation of a intraocular lens. So the treatment is extracapsular cataract extraction by phacoemulsification or small incision cataract surgery with implantation of a posterior intraocular lens. Okay, extracapsular cataract extraction. Now cataract extraction is of two types. We have intracapsular and extracapsular, and the most widely used technique today is extracapsular cataract extraction. And now this is again of several types, and the most commonly used is phacoemulsification. Okay, if phacoemulsification is not used, then small incision cataract surgery is done, and once the cataract is removed, there is implantation of the posterior intraocular lens. And we'll be discussing the treatment, the steps of treatment, the complications of cataract surgery, all in another lecture. So this completes our discussion on cataract, where we discussed the basic anatomy of the lens, the cortex and the nucleus. Then we discussed the definition of cataract, which is basically an opacity in the lens or its capsule. Then we discussed in detail the senile cataract, where we discussed the morphological types. So remember, cortical senile, nuclear senile, and mixed senile cataract. Cortical is again of two types, cuneiform and cupuliform. Then we discuss the pathology, where we discuss that the cuneiform cataract, the cortical cataract, is due to hydration of the lens, leading to coagulation of the lens proteins, which leads to development of opacity. And in nuclear cataract, there is sclerosis of the nucleus. After discussing the pathology, we discussed the stages of maturation of cortical senile cataract, and we discussed the stages of lamellar separation, incipient cataract, immature senile cataract, and mature senile cataract. And finally, hypermature cataract, which is again divided into Morganian type and sclerotic type. Then we discussed the clinical features, the symptoms and the signs. Remember the four points to be noted in sign: the visual acuity, the color of lens, the iris shadow, and the whether the fundus is visible or not. Then we discuss the three complications and the treatment. So this is about cataract.